Good morning. Yesterday, I announced a significant update to the coronavirus.iowa.gov website, where we're now rolling Iowa's COVID-19 numbers in real time. The latest update allows you to see case counts for the current day and look back at the numbers for any day since we began testing in early March. You can see trends for the state as a whole and for individual counties. You can review data on specific demographics, recovered cases, and reported deaths, and see results from serology testing. The best way to understand the data and what it's telling us about virus activity is simply to explore the site. I want to spend a few minutes showing you some of the new features, and in doing so, I'll provide an update on the current state of COVID-19 across Iowa. From the homepage of coronavirus.iowa.gov, click on Current Cases in the main navigation, or just scroll down the page. The four graphs you see provide an at-a-glance view of individuals tested, individuals positive, total recovered, and total deaths. Each bar graph provides the numbers of each individual day and includes a rolling 14-day trend line indicating what's happening over time. You can clearly see that the trend line for individuals testing has risen dramatically over the last few weeks, reflecting our expanded testing capabilities across the state. You'll also see that the number of positive cases is trending down, total recovered continues to trend up, and we are closely monitoring trends in deaths. The chart below shows all this data by county, and each graph and the chart can be downloaded to a spreadsheet by simply clicking on the icon in the top right corner of each item. So let's move on to case counts. Here you'll see an overview of the numbers of Iowans who have been tested, those who tested both negative and positive, the positivity rate over time, and for the previous day. Again, you can visually see the trends in these numbers. While the numbers of Iowans testing positive are trending down, the number of individuals testing negative is trending up. In fact, 1 in 34 Iowans test negative compared to 1 in 206 who test positive. We've also seen the percentage of individuals testing positive over time decrease gradually over the last 2 weeks. Currently, our average positivity rate over time is 14.3%, and yesterday's rate was 7.1%. You can also look at positive cases by county. Just click on any county on the map, and the numbers on the graphs above will update to show only that county. The graph below the map will show you daily totals over time. Just hover over any bar to display the number of positive cases. You can also see statewide numbers for positive symptomatic versus asymptomatic cases, and a variety of demographic information including age, gender, race, and ethnicity. These numbers are not provided by county to prevent identifying individual cases. Further down on the page, you can see similar data for recovered cases by county, daily numbers and demographic information, and the same information is available for deaths. Next, let's take a look at the newly revised long-term care dashboard. Here you can track the number of reported outbreaks, staff, and residents of long-term care facilities who've tested positive and recovered, the number of residents who have sadly lost their lives to the virus. Bar graphs show the trends for positive cases and those recovered. The chart below breaks the information out by facility. Symptomatic versus asymptomatic cases are also provided, as is demographic information. Finally, we've included a new section specifically dedicated to information about results from serology testing. As you can see, more than 12,000 Iowans have been given a serology test, which detects COVID-19 antibodies and indicates that a person has had and recovered from the virus. I've asked Dr. Badati to share more information about how we're using serology now and what we've learned and plans to potentially expand this testing even more.
Thank you, Governor Reynolds. So when we talk about serology testing, it's important to keep in mind that this is a different kind of test from the diagnostic PCR testing that we've been doing to find people who have a current infection. So that PCR testing is what involves a swab in the nose, and that's looking for tiny pieces of genetic material that indicate that somebody is infected with the virus currently. Now, serology testing is a slightly different kind of testing. This uses a sample from the blood to look for proteins called antibodies. Now, these antibodies are things that our white blood cells form as part of the response to a variety of bacteria and viruses. So when the body is exposed to something new, our white blood cells will start to make some of these antibodies in a general way, but then they learn how to make more specific antibodies that are specific to the parts of a bacteria or virus itself. And those are really valuable because that's what's going to help us learn how to fight something again if we have to see it again. And that's precisely how our vaccines work, by showing our bodies a small piece of something so that if we have to see it, we're able to fight it, which is why it's so important for people to continue to stay up to date on things like those routine vaccines. Now, we know that people who have been infected with COVID are starting to develop these kinds of antibodies. And in fact, the FDA has issued what we call several emergency use authorizations or approvals for tests to help detect these kinds of antibodies. And our own state hygienic laboratory is using one of these tests. In fact, SHL has now made this test available through a test request form on their webpage, where providers can decide if it's needed for an individual patient. And the guidance we've provided is for those individuals who may have been suspected or confirmed to have had COVID-19 and have been at least 7 days since their symptom onset, because remember, it takes a little bit of time for those antibodies to develop. We also suggest that it could be considered in people who want to be plasma donors. So these are people who would have been infected with COVID who are now trying to donate blood or plasma to help treat people who are currently infected, which is a really important thing to do. And then finally, we've included healthcare workers, first responders, and critical infrastructure workers to help us better understand what some of their exposures might have been. Now, all of these tests may also be offered at other laboratories, and these tests all fall under the mandatory reporting order to the Iowa Department of Public Health. And we ask that these tests be reported to us because we do follow up with these individuals. We're trying to learn a little bit more about their potential exposures, a little bit more about what they do, and perhaps help us learn more if these people were then to become sick again. This is another example of information, as you heard from Governor Reynolds, that we're now sharing on our webpage as well. So if you visit the webpage at coronavirus.iowa.gov, in addition to seeing information about positive PCR tests or currently infected individuals, you'll also see information about these serology tests. And that information will show you those tests over time, and it will show you where those tests are coming from in counties across Iowa. And it will also show you the percent that are positive so far. So you'll see, for example, 1,672 of the 12,069 reported tests so far, or about 14% are positive so far. There have been many efforts in other countries and other states to start to look at things like this, and as we gather more information, we'll be able to learn a bit more. Others have seen ranges between 2 up to 20%, depending on the population that we're looking at and the kind of sample that we might do. Now, you've heard me say many times that there are many things we have to learn about this virus as we move forward, and this is another example of a place where we have more to learn. We don't yet know how well these antibodies work, and we don't know how long that they last. But it's going to be really important for us to better understand the kind of immunity that people are developing, and also to help us understand where in our communities this virus might have been and where it might be moving. And so this is another example of a tool that we're going to continue to use to learn more, to gather and share information as quickly as we can with Iowans to help you all make safe and healthy decisions for your families. And with that, I can turn it back to you, Governor.
Thank you, Dr. Padati. I want to commend you and your team for the forward-leaning approach with serology testing. Not many states are using this test to the extent that we are at this time, so I'm extremely proud of the work that you're doing and the difference it's making in helping us really understand even more about virus activity as we all work with Iowans and their families to contain and manage it while implementing our recovery plan for Iowa. So stay on in case we have any questions, but I appreciate that update on serology. So for working parents, that raises many questions about childcare as we're talking about getting Iowans back to work. Moms and dads want to be assured that childcare is safe, and others may be looking for a new provider. That is an important issue that many parents are struggling with as they prepare to return to work. I've asked Kelly Garcia, the Director of the Department of Human Services, to provide us an update and some reassurance to Iowa parents about how we're supporting child care across the state of Iowa. Director Garcia?
Hi, Governor. Thank you for having me. I'm Kelly Garcia, the Director of the Iowa Department of Human Services. As a working mom of 2 young kids whose child care center is currently closed right now, I know just how difficult this balance is. So when it comes to our department's role in ensuring Iowa's children have access to safe, quality child care, I take this responsibility incredibly seriously. And I know right now many parents are concerned. I want to share some of the things that we're doing to help support our child care providers and ensure the safety of all children in Iowa. These are challenging conversations, and I want you to know we are very thoughtful in our guidance. We're working closely with the Iowa Department of Public Health, and we're balancing both the public health aspect and the overall well-being of children. We also know how important accessible childcare is to help parents continue to work or return to work. Like you, we want children to be in safe environments with appropriate background checks, hygiene practices, and safety measures. And to that end, we've issued robust guidance with strong mitigation and hygiene measures and clear reporting protocols. Child care providers check temperatures of staff and children, and parents drop their children off at the door. We're going to be working closely, tracking any reports of illness in partnership with IDPH, and we'll be releasing updated guidance later this week as well as guidance for summer camp. This guidance directs all child care providers to report positive COVID cases of staff and children. The recommended time for closure may vary depending on the number of cases, the location, and the size of the program, and closures may be from 2 days to 2 weeks. We will work closely with IDPH to determine the appropriate time frame and to ensure robust hygiene and cleaning before any reopening occurs. We will ensure all staff and children have access to testing. In addition to updated guidance for child care providers, we'll also be providing guidance to parents to help them identify safe, good programs during the summer, to help them know what to look for and to ask the right questions so they feel confident in their child care decisions. Over the past few months, we've worked to equip our child care providers with disinfectant and thermometers. This isn't a role we typically fulfill, but was absolutely the right thing to do. We're providing financial support to ensure child care providers are able to close and deep clean should they need to. And we're providing them additional financial support because we know that there was a child care shortage in Iowa before the pandemic, and we need to ensure continued access to child care long after the pandemic is over. Because of all these efforts we've undertaken, we continue to ensure that safe, quality child care is available throughout our state for essential workforce and for our returning workforce. With more than 10,400 child care slots currently available, you can find all of this information as well as a map to locate child care that meets all of our safety requirements and reporting practices on our website, dhs.iowa.gov. To the parents tuning in, I know the things we have to balance are tough in the best of times. At DHS, we're trying to strike the right balance using all the tools we have, and we'll continue to adjust our approach as we move forward in very close consultation with public health. To the child care providers, thank you for being there to support Iowa's families. And to my DHS child care team, the work you've done to support families and providers alike is nothing short of tremendous. Governor Reynolds, thank you for your leadership during these uncertain and unprecedented times. Thanks for having me here today.
Thanks, Kelly. I appreciate that very much. And as I also want to thank you and your team for the support that you've provided for so many Iowa families across this state during this really unprecedented time. And I know that the new child care guidance will be very reassuring to providers and families as more Iowans return to work. In closing today, I too want to take a moment to thank all of the child care providers across Iowa. Child care is always essential, but never more than it has been these last 11 weeks. Without child care centers and in-home providers remaining open, our healthcare workers, our first responders, manufacturing employees, and others would not have been able to do their part to keep Iowans healthy and safe and keep our essential businesses operating. So thank you for caring for Iowa's children and supporting their families throughout this critical time. And with that, we will open it up for questions.
Dave Price, go ahead.
Good morning, Governor. I don't know if this is a question for you, but probably maybe you and Dr. Padati. What is your guidance now that you've been reopening? What's your guidance for families who are now thinking about should their kids be able to go play with neighbors? Can you talk just a little bit more about social interaction? Basically, you still have the guidance that we shouldn't have gatherings of more than 10 people, but what if it's beyond family? Can you guide people as they start looking at Memorial Day gatherings and such going forward? Play dates, all those kind of things?
Dr. Padati, do you want to address that? Can you hear the question?
Yeah, thank you. I think it's a great question, and it's another example of a place where I think we're going to continue to have conversations to support families as we start to get back to regular activities. And I think as a pediatrician in particular, I appreciate that it's particularly hard for some of our younger kids to understand social distancing. And so thinking about what we practically do to help get back to some of those interactions in a safe way is going to be really important. So I think thinking about doing things slowly, right? Still thinking about those smaller gatherings, still thinking about all of the good public health measures like frequent hand washing when possible, even with children, and also thinking about how, we want to make sure if there's somebody who's sick or somebody who's been around or in close contact with somebody who's sick, those people still need to be staying home, right? And still keeping, our older Iowans or Iowans with underlying conditions, still encouraging those people to avoid those, more intense group gatherings or higher risk settings as much as possible is going to be important. But I do think we recognize that there's a lot of important things for children as part of their development and growth that we need to start getting back to, and we want to do that in a safe way. And so I think we can continue to provide support and guidance on that. And right now I would say we want to just make sure people are practicing those good routine public health measures, staying alert when people aren't feeling well, keeping a close eye on symptoms in children and adults alike, and still reinforcing, those public health strategies, particularly among our vulnerable population.
Thank you, Dr. Padati, and we're going to continue to work on those. Iowans are doing a great job of being responsible, and as we do that and we continue to see the numbers trend in the way that they are, then we're going to continue to look for opportunities to, in a very responsible and safe manner, move forward.
David Pitt, Associated Press.
Yes, thank you. So, Governor, there's reporting out today that the Trump administration plans on pulling 40,000 National Guard soldiers on federally approved Title 32 coronavirus duty in the state on June 24th, which would be just a day before many qualify for early retirement and education benefits under the GI Bill. Are you aware of any plans to end the federal deployment on June 24th? And if so, what effect would that have on our testing and the assistance that these guardsmen and women are performing? And does it bother you that might shortchange them if they are pulled off duty?
No, first of all, I want to thank the Trump administration for actually authorizing Title 32. That has brought tremendous resources to our attempt to deal with the COVID-19 pandemic, and so we're very appreciative of that. We've already sent in and asked for an extension. They did that through June. We will be asking for an additional extension to keep the Title 32 in place through possibly the end of July. So we're already working on asking for an extension, and actually several of the governors that were on the phone call yesterday reiterated the same thing. Great appreciation for allowing the Title 32 and to give us the resources that the National Guard. They've been critical in the case investigation and helping helping us set up the Test Iowa sites across the state, as well as delivering our PPE to different long-term care facilities and hospitals across the state. So we're very grateful to their efforts in addressing the pandemic, and we're going to continue to work with the administration and look for ways to extend that a little bit longer.
We're going to go to Ron at the Gazette.
Thank you, Governor. You're about a week out from deciding whether to reopen the remaining businesses that have been ordered closed under your emergency proclamation. Some of those appear to pose special challenges for social distancing and crowd control. Are you using a different or stricter set of criteria in determining how and when to allow those activities to resume, and what are your metrics telling you at this point?
So I think when we look at some of the larger gatherings and the length of time that they are gathering, that's some of the data points that we're looking at when we're making the decisions. But what we've seen as we work with the different associations and the different businesses is they really are being proactive and reaching out to us and talking about the good practices that they're putting in place so that they can actually apply social distancing, that they can limit the capacity to the businesses, and just various things that they're trying to be proactive on, whether that's mask, facial covers, just different parameters that they're putting in place. And so we've had several organizations reach out to us. We'll be reviewing that. And we'll be making an announcement tomorrow. And then as we continue to review the declaration that we have in place, we'll make some other announcements next week, because I think it expires on the 27th or the 28th. So we're continuing to reevaluate on a daily basis. We know that it's important that we continue in a very responsible, safe, measured, phased-in manner to continue to open up. And what we're seeing from businesses and from Iowans, they also are being very responsible and thoughtful in how they are bringing their businesses back online. So it's been a great effort by everyone across the state, and because of that, we're continuing to see positive trends. And so we're going to continue to monitor that and look for opportunities to continue to bring more businesses online. The list is getting narrower all the time. Easy for me to say, right?
Natalie, Iowa Public Radio.
Governor, I was wondering kind of what kind of serology tests the state is using, and sort of how are you using these serology tests to sort of make decisions about the state and reopening?
Dr. Padati, I think she said it's another tool.
Yeah, so the exact assay that our state hygienic laboratory is using is an Abbott Architect that detects IgG. So it's type G immunoglobulin, which is that longer lasting memory type of antibody that I mentioned. And again, this is one of the tests that's received an EUA through the FDA. And the way that we've been offering it so far is to those groups of individuals that I mentioned. So people who have been suspected or confirmed to have had COVID-19 and for whom it's been at least a week since that time period, because we need to offer time for those antibodies to develop. Persons who want to be confirmed for plasma donation, again, which is just an incredibly important thing to help, provide a potential option for currently sick people. And then those healthcare workers, first responders, and critical infrastructure workers. And, the goal with a group like that is to try and understand, given that they've continued to have to serve in roles, throughout this response, is to try and understand what some of their exposures might have been. Now, in addition to that, there are also other labs that might be offering this test, again, that should be reported to the state. And when we look at all that information, it's another way for us to help understand disease activity. And so it's just another tool that we can use to get a sense of the patterns of where this virus may have been and where there may still be portions of the population that maybe have not yet been exposed. And again, it's an example of a place where we need to understand a little bit better how long that immunity lasts before we can provide people with additional information about what degree of protection they might enjoy based on that antibody test.
Thank you, Dr. Padati.
Chris, KCCI, go ahead.
Hi, good morning, Governor. So following up on something from yesterday, now that you have some time to look it over, and with Congresswoman Axne calling for an investigation in this, Was wondering if you feel that the OSHA inspections in Perry were handled correctly, or if it does indeed merit a deeper look.
Yeah, so thank you for that question. I appreciate that. I was actually going to comment on that before the press conference was over. We did have an opportunity for my team to reach out to Director Roberts to understand what had taken place, and it appears that they followed normal and their appropriate process. The complaint actually came in online through the federal system over the weekend. It came in on the 13th. They responded within 5 business days in writing, which was on the 20th, but they had in fact already been in touch with the Tyson, other facilities, and the Perry plant to talk about some of the processes that they were putting in place. So they do have a process that they go through that determines the seriousness of the complaint and therefore how they respond to the complaint. So they do this on a case-by-case basis, and they have been on site with some of the other companies that had filed a complaint that warranted a site visit. So they had, like I said, already been in contact with the Tyson Perry plant, responded in writing within 5 days, and actually at the time that they were talking to him, they'd already proactively made the decision to shut down the facility, do some extensive cleaning, and start to implement different practices. So I want to just finish by saying how much I appreciate the hard-working investigation and the state employees that are responding to these complaints, and really the proactive approach that they're taking every day to make sure that companies are implementing safe practices. So I want to just give a shout out to the workforce at OSHA and the great job that they're doing and working around the clock to meet the needs of individuals who are concerned about maybe some conditions that they're working in. So I appreciate that very much, have followed up, and will continue to monitor that.
We've got time for 2 more questions. Amy, Waterloo Courier.
Yes, thank you, Governor. In regards to your serology test numbers, Blackhawk County has kind of a high number, and I was wondering, is that separate from the positive case numbers? Because we're also seeing a discrepancy of a couple hundred cases from the county officials' numbers versus the state.
Well, some of that may be in the way that we're reporting the data now. We talked about that yesterday, but Dr. Padotti, do you want to answer that?
Yeah, so the numbers that you'll find on our webpage on the coronavirus.iowa.gov, our PCR or diagnostic tests are going to be reported separately. Those are cases of infected individuals. And then the serology tests are going to be reported separately. So that's not going to be, you're not going to see sort of they're not included together. They're reported as separate instances because they're sort of different situations. But as you might imagine, they're related, right? So in areas where we might have seen people who have become infected, we know that there is virus activity in that area. And so it's possible that there could have been people who had such mild illness or maybe even no symptoms at all who didn't know they were infected, who then might be positive on a serology result. So part of those differences, is probably because we're reporting those a little bit differently. But I understand, that question, and that's how we're going to share them is as 2 separate, pages, 2 separate results.
Last question, Des Moines Register.
Yeah, kind of building off the serology questions, Dr. Padotti, the tests have helped other states understand how many asymptomatic COVID-19 cases may have been undetected. Are we getting an idea of these through Iowa's serology test? And if so, what are we learning so far about them?
Yeah, so we're reporting information about symptoms for both of these situations. So you can see the asymptomatic data that's included under our case report page on the coronavirus webpage. And you're right, that's an important piece of understanding, not just when somebody receives the result on the PCR test, but also on the serology test. So with regard to asymptomatic individuals and serology, that's exactly why, as part of this, we're asking that those tests be reported to the state so that public health can follow up with those individuals to ask them questions about if they think they've had symptoms, if they think they've been exposed, those sorts of things. Now, sometimes that can be a little bit hard, depending on the amount of time that's passed. But you're right, it's another way that we might be able to better understand, what we're seeing in terms of the breadth of people who've been affected and what sorts of symptoms that they've experienced. And so as we get more of that information, we'll continue to share that.
So I want to again thank Dr. Padati for joining us today, Director Garcia, and Sarah Reister from the Department of Public Health. So have a great day. Thank you.
Thanks, everyone.